Hi, my name is Dr. Kris, and I want to talk to you about something that's near and dear to my heart, which is heart health. I'm sure all of you are listening because heart issues, heart disease, high blood pressure, high cholesterol has probably affected you or maybe a family member or friend that's really close to you. And the truth is, the same thing has happened to me. That's why I'm so passionate to bring truth and to bring light into this subject to actually help people. My story is that my grandfather passed away in his late 40s from a massive heart attack, didn't even know that it was coming on, and basically did not survive. And unfortunately, I never got a chance to meet this amazing man that everyone says he was. So it's kind of a missing part in my life because of heart disease. Sad thing is my mother followed in his footsteps and actually had her first heart attack when she was in her late 40s, open heart surgery. She's had multiple open heart surgeries, bypasses. She's also had stents put in her heart. And with all of the medications and everything else that she's been on over the years and stuff, she is not still a very well woman. She has lots of limitations and restrictions on her life. And again, she right now has some heart issues. The doctor says because of all of the surgery she's been through, there's really nothing else they can do. So I'm always living in that life of the phone rings, what's going to be the answer? What's my mom going to say is actually happening to her right then and there. So I live in that fear and that concern, and that's not a great way to be. And then it's also affected me personally. I actually had a exam done a couple of years ago for life insurance, and it came back that I actually had a heart condition myself. So here I am following in the same footsteps as my grandfather and my mother. And I actually had an electrical component of my heart not working well. It's called a bundle branch block, where the nerves in my heart's not flowing the right way to communicate the right signals to make your heart work well. So it shocked me. It shook me to my core when, again, I'm about health and promoting health and stuff. And when I get a test result saying that I failed and I have a heart problem, it really, really took a toll on me. But what I did is I really dug in and I really did some research and I really figured out what's really causing this. I had to figure out a different solution other than just living with it to what caused the heart problem and stuff. But I wanted to do it, and I actually, again, proud to say and stuff, I found a solution for it. I did the right steps, which I want to share with you to reverse it. And a year after I did that test, I did another test, EKG in my heart, and it came back completely clear. I got the best rating in my life insurance and stuff, and I want to share with you how I did that, because I don't think you are destined to follow the genes of your relatives, that it is changeable. We're going to show you why that is. And I also share the insights that I've learned along my journey and about my journey with my family and stuff, how to become healthier and really solve underlying issues, not just suppress them with drugs. So I want to share with you a little bit of a presentation I do here in my office, so you can actually have some insights into heart issues. I'm going to talk about the current medical model of how it's working and the fallacies with some of that, talking about a different paradigm shift, looking at more of a wellness mentality, discuss about chiropractic, what's its role in heart conditions. I am a chiropractor through and through, so I want to talk to you and how you understand that, talk about supplementation, and also the next step, how you can get help and assistance with it. So let's just transition right now to my screen share here. So this is kind of the medical model that most people go to. So you either go to the medical doctor, you have a test done, either comes back an EKG or a blood work, and something's off balance. So what do the doctors say? Oh yeah, this is off balance. They talk about your parents have this and your grandparents. Oh yeah, they do. Well, it's all in your genes. Guess what? You're basically screwed. There's nothing you can do. The only thing you can do is medications, and we'll try to manage your condition for as long as possible. And then basically, once it gets really severely bad and stuff, then we'll have surgery and stuff. We're going to do bypasses, we'll do stents, we'll just kind of keep things going. So this is basically the best we can do is again, it's something all genetic, and you're looking at a lifetime of medications and surgery. So it doesn't sound too exciting to me. So how is that performing itself? Let's look at that. So as we do know and stuff, there's over 150 billion of open heart surgeries that are done, or heart procedures that are done. The New England Journal of Medicine, which is the most prestigious journal that's done, had a study that came out that said 95% of the patients that receive these surgeries, supposedly life-saving surgeries at a cost of $150 billion, do nothing, does not change or alter their health outcomes, and less than 2 to 3% of the cases, is there any improvement in their life longevity or life quality, which is shocking to know. But what they also did in that same research journal, New England Journal of Medicine, actually came out with what's called an heart study, basically where they looked at people who changed their lifestyle and found out that 90% of all heart disease was actually changeable, is preventable about what you do. That's how I did it. So I want to teach you actually that 90% instead of relying on the 2 or 3% of medications and surgery. So heart disease all comes down to one number. If anyone knows anything, some people don't even know their weight, their height, whatever, but almost everyone guarantees knows their cholesterol level, right? This is kind of crazy and insane. But we also have to understand cholesterol is not the go-to end-all be-all when it comes to heart disease, because one thing you have to look at, and if we just look at the basics of it, is if you basically look at the definition of cholesterol, you're going to find out cholesterol is actually essential. It's not the boogeyman. It's not the bad thing that's causing all the problems that doctors want you to believe. It's essential. It is what encompasses each individual cell of your body. It's what the cell actually uses to separate itself from other cells. Is called cholesterol. And if it doesn't have that barrier around the outside, everything just kind of runs together. It's kind of like your house. Why do you have walls in your house? It's to separate the inside from the outside. And cholesterol is like the walls of each cell. So it's essential. You can't live without it. Your brain is encapsulated with 100% cholesterol. Your hormones are made out of cholesterol, your bile salts are made out of cholesterol, and vitamin D that's essential for your body is actually made out of cholesterol. So just knowing stuff, the lower the cholesterol goes, the less these essential functions that are necessary for cholesterol to be there is going to be affected. So this was just a couple studies that looked at lowering cholesterol. What effects did it have over here? There's a Framingham study that showed if you get your cholesterol lower than 200, actually people suffered heart attacks 40% more times when they got their cholesterol below 200. Over here was looked at as people who are on heart attacks or on cholesterol lowering medications, but then research shows that if you have cholesterol lowering than 180, that you have an increased risk of strokes. So it is crazy to think that. And then the paragraph at the very bottom shows that it says demands will increase cholesterol requirements include stress, inflammation, elevated demands of insulin, carbohydrate take, the cholesterol levels in your body determined by your environment. So it's what you do, it's what you put in your body, it's how you think, it's how you're stressed out. That all determines your cholesterol level, not your genes. It's all about what you do. And that's what the good news is actually reversible. This is just a correlative study that looked at hundreds of different research articles out there, and they found out that data reveals that most heart attack victims had cholesterol levels no different than those who did not suffer a heart attack. So basically, people who have heart attacks can have high cholesterol, low cholesterol, or in the middle. If we even look at just looking at social, cultural differences and stuff, if you look at our cholesterol levels compared to Japan, our heart attack risks are 3 times more than what Japan has, even though Japan, as a country as a whole, has cholesterol levels that are 30 points higher than what we do. Higher cholesterol, lower heart attacks. We have lower cholesterol, higher heart attacks. So there's no correlation between cholesterol and heart attacks. It's basically bunk. And I'll show you why that is in another presentation here coming up. So if you have high cholesterol, everyone wants to learn statin drugs, and that's going to solve the issues. Not only does it not solve the issues, it also gives you tons of side effects. This is just a list of all of the things that happen when you take cholesterol meds. And then as I tell people, it's not when you take cholesterol medications, this is going to be one of the things that can affect you. It's no, you're going to get all these, and then the only question is when you're going to develop a lot of these symptoms and side effects, from neuropathy to anemia, acidosis, frequent fevers, cataracts, sexual dysfunctions, yes, erections, immune problems, pancreatic dysfunctions, pancreatitis, liver dysfunctions, increased risk of diabetes, muscle pain, that's all the sore legs, nerves, muscles, nerve damage, dizziness, memory loss, and depression. If you look at this list, this is a list of the things that are the most affected Americans right now. This is a list of our current biggest health problems we're facing right now, and most of them are medication related. If you get people off of medication, you would can eliminate most of these health issues, so which is crazy and sad at the same time. How big of a risk is it? Look at this. This shows you people who are on lower cholesterol medicines are 6 times more likely to develop depression. Why have we had people in depression? We live in the safest, most economically advanced time in history at any point in time and stuff. And it's like, we're depressed. We have everything to be happy for, very little things to really stress us and worry us, but we got depression at an all-time high, which is super sad to say that. So, but I do know there is a better way. In the next presentation, I'm going to talk to you a little bit about this better way that we do on a regular basis and how we help patients really become healthy and well and actually make sure that they get the results they're looking for without the side effects.